After 60. Authority. Life goes on after 60.
If you're over 60 and you've noticed you're walking a bit slower, getting tired more easily, losing weight without trying, or struggling with things that used to be simple, you might think it's just normal aging. But Australian geriatricians now warn that these small signs often signal frailty syndrome, a dangerous condition that predicts falls, hospitalization, loss of independence, and early death. Today you'll discover the 7 subtle warning signs of frailty that older Australians and their families ignore until it's too late, and the proven steps to reverse it. Stay strong and keep living at home.
There's a moment in many older Australians' lives when the balance tips. You've been managing well, living independently, driving, cooking, gardening, seeing friends. You're in your 60s, maybe just retired or thinking about it. Life feels reasonably good. Then something small happens. A chest infection that takes weeks to recover from. A minor fall that shakes your confidence. A period of stress or grief that drains your energy. And after that, you never quite get back to where you were before. Your walking slows down. Stays become harder. You feel exhausted after simple tasks. You start losing weight without meaning to. You withdraw from activities because they feel too demanding. Your family notices but doesn't say much. They assume you're just getting older. You notice but try to push through. You don't want to seem weak or be a burden. What you might not realize is that you're experiencing frailty syndrome, a measurable medical condition that affects up to 1 in 4 Australians over 65, and the process often begins in the 60s. While frailty becomes more common with advancing age, the early warning signs typically appear much earlier, giving you a critical window for intervention. Frailty isn't just being old and weak. It's a specific state of reduced physiological reserve that makes your body extremely vulnerable to stresses, illness, injury, medication changes, emotional trauma, even changes in weather. When you're frail, what would be a minor setback for a robust person becomes a major crisis for you. The terrifying thing about frailty is how quickly it can cascade. One chest infection leads to bed rest. Bed rest leads to muscle loss. Muscle loss leads to a fall. The fall leads to hospitalization. Hospitalization leads to delirium and further decline. And within weeks, a previously independent person can no longer live safely at home. But here's the critical message Australian geriatricians want you to hear. Frailty is often reversible, especially if caught early. With the right interventions, targeted exercise, high-protein nutrition, medication review, social support, home modifications, many older Australians can move from frail back to robust. In this episode, you'll learn the 7 early warning signs of frailty that predict serious decline. You'll understand why each sign matters, what's happening in your body, and, most importantly, the specific actions you can take to reverse the slide and protect your independence. If you're over 60, or if you have a parent or loved one in that age group, this might be the most important health information you hear this year. Recognizing frailty early and acting on it can be the difference between 10 more years of independent, joyful life and a rapid, preventable decline into disability and institutional care. Understanding frailty syndrome, what it is and why it matters. Frailty is formally defined as a clinical syndrome characterized by decreased physiological reserve and resistance to stresses, resulting from cumulative decline across multiple body systems. In plain English, your body's backup systems are failing, so even minor challenges can cause major problems. The 3 dimensions of frailty: physical frailty, weakness, slowness, exhaustion, weight loss, low activity, cognitive frailty, memory problems, confusion, difficulty with complex tasks, social frailty, isolation, lack of support, loss of meaningful roles. Often, all 3 occur together and reinforce each other in a vicious cycle. Why frailty matters. People with frailty have 2 to 3 times higher risk of falls, 4 to 5 times higher risk of disability, 3 to 4 times higher risk of hospitalization, doubled risk of death within 3 to 5 years, much higher rates of delirium, dementia progression, and loss of independence. In Australia, frailty prevalence has risen 46% over the past decade among people accessing aged care services. It's now recognized as one of the biggest challenges in aged care. but also one of the most preventable and treatable. The fried frailty phenotype. The gold standard geriatricians use the fried frailty phenotype to diagnose frailty. You are considered frail if you have 3 or more of these 5 criteria: unintentional weight loss, 4.5 kilograms or more in the past year, exhaustion, self-reported feeling that everything is an effort, weakness, low grip strength, slow walking speed, taking longer to walk a set distance, low physical activity, sedentary or minimal activity. If you have 1 or 2 of these, you are considered pre-frail, at high risk of progressing to full frailty. But you don't need a doctor with special equipment to spot frailty. There are observable everyday signs that signal danger, and those are what we are covering today. Sign number 1. Walking speed has slowed noticeably. What it looks and feels like you used to walk briskly, easily keeping pace with others. Now you've slowed down. People walking with you have to adjust their pace. Crossing the road before the lights change feels rushed. Walking to the shops and back leaves you tired. You might tell yourself, I'm just taking my time, or I'm being careful. But deep down, you know you physically can't walk as fast as you used to. Why it matters: walking speed is one of the single best predictors of health and survival in older adults. It's sometimes called the 6th vital sign, as important as blood pressure or heart rate. Why? Because walking integrates almost every body system: muscles, leg, hip, core strength, cardiovascular system, heart and lung capacity, nervous system, balance, coordination, bones and joints, structural integrity, brain, cognitive function, spatial awareness, metabolic system, energy production. When any of these systems decline, walking speed drops. The critical threshold, a walking speed below 0.8 meters per second, taking more than 6 seconds to walk 5 meters, is a strong predictor of frailty, disability, and mortality. What's happening in your body? Sarcopenia, muscle loss from age 50. Untrained adults lose 1 to 2% of muscle mass per year. Reduced cardiovascular fitness. Heart and lung capacity decline with inactivity. Balance problems. Age-related changes in vision, inner ear and nerve function. Joint pain. Arthritis limits stride. Low energy. Chronic fatigue or underlying illness. What to do? Step 1. Measure your walking speed. Mark a 4-meter course. Walk at your normal pace. Time yourself with a stopwatch. Repeat 3 times and average. Calculate 4 meters time in seconds equals speed in ms. If below 0.8 meters per second or declining noticeably, act immediately. Step 2. Start a progressive walking program. Walk 20 to 30 minutes daily, 5+ days per week. Start where you are, even 10 minutes. Increase by 5 minutes per week. Gradually increase pace. Step 3. Add resistance training for legs, chair, sit to stand. 10 representatives, 3 sets, 2 to 3 times per week. Step-ups, 10 representatives per leg, 3 sets. Wall push-ups, 10 representatives, 3 sets. Progress by adding weight or slowing movement. Step 4. Address barriers. Pain. See GP about arthritis management. Footwear. Wear supportive shoes. Vision. Get eyes checked. Fear. Ask for falls assessment. Step 5. Get professional help. Ask your GP for referral to physiotherapist or exercise physiologist. Evidence. Resistance training significantly improves walking speed and physical function in older adults. Sign number 2. Unintentional weight loss, especially muscle loss. What it looks and feels like: you're not trying to lose weight, but the scales keep dropping. Over 6 to 12 months, you've lost 4 to 5 kilograms or more. Your clothes feel loose. Family members notice you look thinner. Why it matters in older adults: unintentional weight loss almost always means muscle loss, not just fat. Muscle is your most precious asset for independence. It powers movement, protects against falls, and supports recovery from illness. Loss of muscle mass, sarcopenia, is a core component of frailty. Less muscle means higher fall risk, slower recovery, and increased mortality. The critical threshold, unintentional loss of 4.5 kilograms or more in 12 months, is one of the fried frailty criteria. What's happening in your body? Reduced appetite and food intake. Depression and loneliness suppress appetite. Medication side effects: reduce hunger, altered taste and smell, make food less enjoyable. Dental problems make chewing difficult. Underlying illness: cancer, chronic infections, thyroid problems, diabetes, heart or lung disease, gut malabsorption, inadequate protein intake. Many older Australians don't eat enough protein to maintain muscle. What to do? Step 1. See your GP urgently. Weight loss requires medical investigation, full history and examination, blood tests, full blood count, inflammatory markers, liver and kidney function, thyroid, blood sugar, B12, calcium imaging if cancer is suspected, depression screen. Step 2. Medication review. Ask if any medications are reducing appetite. Common culprits: metformin, blood pressure drugs, SSIs, opioids. Step 3. Increase protein intake. Target 1.0 to 1.2 grams of protein per kilogram of body weight daily. Example: 70 kilograms person equals 70 to 85 g protein daily. How? Breakfast: eggs, 2 is equal to 12 g. Greek yogurt, 200 g equals 20 g. Lunch: tuna or chicken, 100 g equals 25 to 30 g. Dinner: meat, fish or tofu, 150 g equals 30 to 40 g. Snacks: nuts, cheese, yogurt. Step 4. Address eating barriers. Dental problems. See dentist. Swallowing difficulties. Ask GP for speech pathologist referral. Loneliness. Eat with others when possible. Step 5. Consider nutritional supplements if you can't meet needs through food. GP or dietitian may recommend high-protein drinks or protein powder. Step 6. Dietitian referral. Ask GP for referral for tailored meal plan and monitoring. Evidence: high-protein nutrition combined with resistance exercise is most effective for reversing sarcopenia and frailty. Sign number 3. Exhaustion and low energy. Everything feels like an effort. What it looks and feels like. You feel tired all the time. Simple tasks feel like they require enormous effort. You find yourself saying, "I can't be bothered" more often. Activities you used to enjoy now feel like burdens. You nap frequently but never feel refreshed. This is bone-deep, relentless exhaustion that doesn't go away with rest. Why it matters: exhaustion is one of the 5 fried frailty criteria. Chronic fatigue in older adults signals that multiple body systems are failing. Muscle deconditioning, chronic inflammation, anemia, heart or lung disease, thyroid problems, depression, poor sleep. Exhaustion creates a vicious cycle. Too tired to be active, more deconditioned, more tired, less active. What's happening? Muscle deconditioning. Mitochondria, energy factories, become less efficient. Chronic inflammation drains energy and promotes muscle breakdown. Anemia, low hemoglobin means less oxygen delivery. Cardiovascular or respiratory disease, reduced oxygen delivery. Thyroid dysfunction. Hyperthyroidism causes profound fatigue. Sleep disorders, sleep apnea, insomnia prevent restorative sleep. Depression causes severe fatigue and loss of motivation. What to do? Step 1. Comprehensive medical assessment. See GP for blood tests, full blood count, iron, B12, folate, thyroid, inflammatory markers, kidney and liver function. Cardiovascular assessment, sleep assessment, mental health screen. Step 2. Treat underlying causes: anemia, iron or B12 supplements, thyroid, levothyroxine for hyperthyroidism, sleep apnea, CPAP therapy, depression, counseling, medication, social reconnect. Ion. Step 3. Start gentle. Progressive exercise, structured physical activity is one of the most effective treatments for chronic fatigue. Why it works: increases mitochondrial efficiency, improves cardiovascular fitness, reduces inflammation, improves sleep and mood. Start with 10 minutes daily walking. Increase by 5 minutes per week to 30 minutes. Add 2 light strength sessions weekly. Step 4. Improve sleep hygiene, same bedtime, wake time daily, no screens, 1 to 2 hours before bed, cool, dark, quiet bedroom, avoid caffeine after midday, morning sunlight exposure. Step 5. Nutrition for energy, regular meals with protein, complex carbs for sustained energy, stay hydrated, limit processed foods. Step 6. Social re-engagement, 1 social contact daily and 1 weekly activity, boost energy and mood. Evidence: exercise, social engagement, and treatment of underlying causes significantly improve fatigue in older adults with frailty. Sign number 4. Weakness, struggling with jars, lifting, getting up from chairs. What it looks and feels like: opening jars or bottles is impossible. Lifting a full kettle is hard. Getting up from a low chair or toilet requires pushing off with hands. Carrying shopping bags is a struggle. Why it matters: grip strength and lower body strength are core markers of frailty. Weak muscles mean higher fall risk, difficulty with daily tasks, increased hospitalization and death risk. What's happening? Sarcopenia. Progressive muscle loss driven by aging, 1 to 2% loss per year from age 50. Inactivity, inadequate protein, hormonal changes, chronic inflammation, illness, and malnutrition. What to do? Step 1. Measure strength. Optional. Chair stand test. Sit in firm chair. Arms crossed. Time 5 stand-ups and sit-downs over 15 seconds suggests significant weakness. Step 2. Start resistance training. This is the single most important intervention. Home program. 2 to 3 times weekly. Chair sit to stand. 10 representatives. 3 sets wall push-ups. 10 representatives. 3 sets step-ups. 10 representatives per leg. 3 sets calf raises. 15 representatives. 3 sets. Progress by slowing movement, adding weight, or using lower chair. Step 3. Progress to supervised training. Consider physiotherapist, exercise physiologist, or community gym. Step 4. Eat enough protein, 1.0 to 1.2 g per kilogram daily. Step 5. Be patient and consistent. Expect improvements in 6 to 8 weeks with consistency. Evidence. Progressive resistance training significantly improves strength and function in older adults. Sign number 5. Reduced activity and withdrawal from hobbies or social life. What it looks and feels like: activities you used to do regularly have quietly dropped away. You spend most days at home sitting. You decline invitations with excuses. You've stopped hobbies because they feel too hard. You feel isolated and life is shrinking. Why it matters: low physical activity is one of the 5 frailty criteria. Reduced activity and social withdrawal create a vicious cycle. Weaker stop activities, muscle loss; weaker isolation, depression; less motivation, further decline. The evidence. Sedentary behavior increases disability risk by 300 to 400%. Social isolation increases mortality by 26 to 32%. Physical inactivity is 4th leading risk factor for death globally. What's happening? Physical factors. Weakness, pain, breathlessness, fear of falling. Incontinence. Psychological factors. Depression, anxiety, grief. Low self-efficacy. Environmental factors. Transport barriers. Lack of local opportunities, financial constraints, low social network. What to do? Step 1. Address physical barriers: pain, GP management; breathlessness, optimize treatment; incontinence, see GP or continence nurse; fear, falls assessment and balance training; transport, community transport services. Step 2. Set daily movement goals. Start with 10 minutes daily walking. Build to 30 minutes over weeks. Step 3. Reconnect with one social activity. Choose one activity weekly. Walking group, U3A class, men's shed, volunteering choir, Tai Chi, craft group. Step 4. Use social prescribing. Ask GP to connect you with local groups and activities. Step 5. Address depression. See GP for depression screening and mental health support. Step 6. Start small. Action creates motivation. Force yourself to attend that first activity. Evidence. Physical activity and social engagement improve function, mood, cognition, and survival in frail older adults. Sign number 6. Increased falls, or near misses, and fear of falling. What it looks and feels like: you had 1 or more falls in the past year, or several close calls. You feel unsteady, especially on uneven ground or in dim light. You grab furniture constantly for support. You've developed fear of falling and avoid activities, which makes you less active, weaker, and more unsteady. Why it matters: falls are both cause and consequence of frailty. Statistics. 1 in 3 Australians over 65 falls annually. Falls a leading cause of injury, hospitalization. Hip fractures have 20 to 30% mortality within 12 months. 50% never regain previous independence, but falls are largely preventable. What's happening? Internal factors. Muscle weakness, poor balance, vision problems, postural hypertension, medications, cognitive impairment, foot problems. External factors. Trip hazards, poor lighting, slippery surfaces, inappropriate footwear, lack of rails. What to do? Step 1. Comprehensive falls assessment with GP medication. Review blood pressure, lying and standing. Vision check, gait and balance test, B12 and vitamin D blood test. Step 2. Strength and balance training most effective. Intervention. Tai Chi reduces falls 20 to 30%. Physiotherapist-led balance training group exercise classes, home program key exercises, single leg stands, tandem walking, sit to stand, step-ups. Frequency, 2 to 3 times weekly, ongoing. Step 3. Home safety modifications: remove loose rugs and clutter, improve lighting everywhere, install grab rails. Bathroom, stays. Non-slip mats in shower, handrails on stays, wear supportive shoes. Step 4. Consider walking aid stick, frame or rollator can significantly reduce fall risk. Step 5. Treat vision problems, update glasses. Treat cataracts, manage glaucoma. Step 6. Vitamin D supplementation if low. Typical dose 1,000 to 2,000 IU daily. Step 7. Address fear of falling, joint falls prevention program. Use walking aid, weigh personal alarm evidence. Multifactorial falls prevention. Exercise plus medication, review plus home mods plus vision. Reduces falls 20 to 40%. Sign number 7. Slower recovery from illness, injury, or stress. What it looks and feels like you used to bounce back from colds in days. Now a chest infection or UTI knocks you flat for weeks. A stressful event takes months to recover from. Each illness leaves you weaker than before. Why it matters: this is the hallmark of frailty, loss of resilience and reserve. When frail, you have no backup. Simple UTI causes delirium, 3 days bed rest causes major muscle loss, minor medication change causes falls, heat wave causes serious illness. Why recovery is slower: chronic inflammation and immune dysfunction, rapid muscle loss during illness, reduce cardiovascular reserve, malnutrition during illness, polypharmacy interactions. What to do: Step 1. Prevent illness, vaccinations, flu, pneumonia, COVID, shingles, good hygiene, manage chronic diseases. Step 2. Treat infections early, don't ignore symptoms. Complete antibiotics, stay hydrated, maintain nutrition. Step 3. Avoid prolonged bed rest even during illness. Get up several times daily. Do gentle exercises. Resume activity as soon as possible. Why? Every day in bed causes 1 to 5% muscle loss in older adults. Step 4. Rehabilitation after illness. Ask GP for referrals to physiotherapist, occupational therapist, dietitian, home care services. Step 5. Build baseline resilience. Stronger before illness equals better recovery. Regular exercise, high-protein diet, good sleep, social connection, minimal unnecessary medications. Evidence: active, well-nourished older adults have faster recovery and lower mortality. The Frailty Reversal Program. 5 proven pillars. Frailty is not a one-way street. With right interventions, many can move from frail back to robust. Pillar 1. Progressive resistance exercise, strength training 2 to 3 times weekly. Only intervention proven to rebuild muscle. Pillar 2. Adequate protein and nutrition, 1.0 to 1.2 g protein per kilogram daily, spread across meals. Pillar 3. Medication optimization, review and reduce unnecessary drugs, especially sedatives and anticholinergics. Pillar 4. Social connection, regular face-to-face contact and meaningful activities. Pillar 5. Home safety modifications, remove hazards, improve lighting, install rails, use aids. How to access help in Australia. Your GP. Comprehensive health assessment. Medicare item 70170370507 for 75 plus. Referrals to physio, exercise physiologist, dietitian, OT. Home medicines. Review my aged care referral assessment for support needs. Home care package, Commonwealth Home Support Program, local council and community centers. Exercise classes, walking groups, social activities. IF your family. How to help: don't ignore signs. Just getting old isn't good enough. Have honest conversation. I've noticed you slower and more tired. I'm worried about your strength and independence. Can we see the doctor together? Support, don't take over. Encourage activity. Help access services. Watch for rapid decline. Final message: choose your path today. At 60 or 70, you stand at a fork. One path: progressive frailty, falls dependence, institutional care, shortened life. Other path: maintain strength, independence, mobility, years, more meaningful life at home. Which path depends on choices you make in next 3 to 6 months. If you recognize 3 or more signs, act now. CGP for Frailty Assessment Start Strength, Training Boost Protein, Review Medications, Reconnect, Socially Contact, My Age Care. Frailty is not inevitable. It's a syndrome that can be measured, treated, and often reversed. Your independence is worth fighting for. Start today.